Now, the neurons are the cells in the brain that determine the efficiency of how we think and how we act and what we're able to accomplish and what we can do in our life. And although there's several areas of the brain that are implicated in ADHD, the dopamine pathways and the activity of the neurochemical dopamine is sort of one of the central areas that relates to ADHD, and especially the area of motivation that we're going to be talking about today. The people with ADHD in general have less sensitive dopamine receptors as a result of how the building blocks of their brain are put together. And when a person has less sensitive dopamine receptors, they need higher levels of stimulation from their environment in order to recruit their neurons to get the same type of behavior that somebody without ADHD might be able to enact with less stimulation. So what does this look like? On average, people with ADHD might have less dopamine recruiting their actions in the brain. They might be less motivated by typical day-to-day situations because of the way their neurochemicals work. And when we think about what functions of the brain this impacts, one of the main ones is the executive functions that are housed in the prefrontal cortex. Now, in a typical adolescent or a young youth who's like pre-adolescent age, you're going to see that these areas of the brain are not fully developed, which means that youth have trouble setting long-term goals. They might not inhibit and monitor their behavior as well as adults do. They have trouble with goal setting. They have trouble with organizing themselves just in general because of their age. We don't expect those abilities to be fully mature until someone's about 25 years old. But for teens with ADHD, these areas are doubly impaired. It's almost like a double disorder of executive functions. And this is because of the way that the prefrontal cortex communicates with other parts of the brain and the architecture of the prefrontal cortex that don't support healthy executive functions. The other piece is the way that we respond to rewards. So dopamine is implicated in our response to rewards, and the strength of communication between the reward centers of our brains, for example, the striatum, and those executive functions is attenuated, kind of weakened in people with ADHD.